Alright, so I'm going to talk briefly about the use of mechanical traction for the treatment of chronic lumbar disc herniation. In general, mechanical traction is used in physical therapy to help relieve compression or tension in the spinal joints, and it can also help elongate soft tissue structures, and it's generally used to help with lower back pain. So in the case of disc herniation, what it will help reduce disc material propulsion by increasing imbibing in the disc, which is a phenomenon where the pressure inside the disc is decreased, so then all the material is sucked back into the disc. Some contraindications that you'd want to keep in mind when treating a patient with traction may include if they've been ordered not to have any spinal joint movement. So this would be in the case of like a spinal fusion or a fracture. You'd get an order from the physician to not do any kind of traction. Other contraindications would include an acute injury, so you do not want to pull on or use a force on a tissue that's still healing. Others may include joint hypermobility, so you'd see this in cases of rheumatoid arthritis, patients who are pregnant, or those with Down syndrome. And then you would also not want to do traction if it increases any kind of peripheralized symptoms. So when we're selecting our parameters for traction, before we start, we want to assess the patient's sensation and cognition, and then we could just educate them and let them know what they could expect going into traction. So just briefly explain what's going to happen and that they're probably going to feel like a stretching sensation in their lumbar lower back region. We would position them prone on the treatment table, and this would extend the spine and pull on the anterior structures of their spine when the machine is on. We would opt for intermittent traction with about a 4-to-1 ratio of hold to relax. So about 60 seconds of holding followed by 15 to 20 seconds of relaxing, and then we'd repeat that as needed during the session. The force that the machine would utilize would be about 25 to 50% of the individual's body weight. In the first few sessions, we'd probably opt for lower in that range, so probably about 25 to 30%, and then we'd increase it as the patient is able to tolerate. And generally, the relax time, the period that it's relaxing is about 50% of the force used during the whole time. In the first few sessions, it just depends on the severity of the patient's symptoms, but generally we'd go for anywhere from 5 to 10 minutes, and then in subsequent sessions we could increase that to as long as 20 to 40 minutes of traction. And then we would repeat this 2 to 3 times a week. And then eventually, if the patient isn't experiencing any decrease in their symptoms, or basically they're not getting better after 6 sessions, we would discontinue traction and opt for something else that would bring up benefits. And then other interventions that we could do for lumbar disc herniation might include educating the patient on proper posture, as well as body mechanics during any kind of activities that they would do. And then we might introduce some like core strengthening exercises, or even lower back, lumbar region specific strengthening exercises to help relieve some of their pain.